As we looked at in the previous section, inflammation happens on a cellular level when you put any kind of pressure on the nervous tissue, whether it's pressure from a trauma or a sudden impact like hitting your funny bone. With the funny bone example, that basically is a nerve that when tapped on with enough pressure, you will get the painful tingling sensation going down your arm to your pinky. The same happens to your nervous tissue inside the skull after an impact. You've likely experienced that after hitting your funny bone, there's a refractory period where you feel pain and buzzing sensation for a few seconds. And depending on how hard you hit it, the pain and buzzing might continue for a while. When nervous system tissue is impacted, whether it be the brain, brainstem, or even peripheral nerves such as your funny bone, when there's pressure elicited upon these nerves, they spontaneously fire. When they spontaneously fire, that results in an outcome that your body's not trying to generate, known as an involuntary or automatic response. Thus, when you have an injury to the brain or nervous tissue, initially by direct traumatic pressure to the nervous system, and then because of the cellular level of inflammation from that trauma within the first 24 to 72 hours, and this could last much longer depending on the magnitude of the trauma, the nervous tissue is basically trying to recover from the excess pressure trauma and subsequent inflammation pressure. It's widely known that if an area of brain tissue is deprived of oxygen and nutrients due to pressure, it will starve off rather quickly, but more frequently slows its metabolism and goes into an almost hibernative state, resulting in dysfunction in the body parts that the injured, inflamed nervous tissue has a connection to. So you can see that a blunt trauma to the nervous tissue, whether it be the first vertebra shearing on the second vertebra and slightly compressing the brainstem, or the brain hitting the inside of the skull, those are all compressive forces, which basically forces that nervous tissue to go into an inflammatory and healing pattern right away. Therefore, within the first 24 hours, it's really just survival mode for the nervous tissue, whether it is the brain, brainstem, or some other nerve in the body. After that survival mode phase, repair starts to take place. I believe that this inflammatory and compressive phase is necessary because it alters function and ability to force the injured person to rest so that some level of repair can take place and a reduction of nervous stimulation is possible. Anyone who has experienced this knows that in this phase, having loud noises, lights, or problems that need thought to solve will cause an overload and possibly anger outbursts. Now, please note, generally speaking, and notwithstanding the knowledge currently have on neuroplasticity, in the rare instance where there is a massive enough compressive force, like one that would cause a bleed on the brain, which then compresses the brain severely for a long enough period of time, minutes in some cases to hours, days in others, this is possible that this scenario could result in irreversible brain change. When you have an accumulation of brain fluid as a result of it not draining through the upper part of the neck and the bottom part of the skull, it creates compressive forces within the skull that are elevated, and when frequent enough, over time will lead to noticeable changes in the function of various body tissues and systems, most commonly gravity dependent. Then when you go lie down, they often gradually decrease. The permanent damage, so to speak, that is caused from day 1 to day 2 is not significant. Generally, it's when this happens day in and day out, month after month, year after year, that this can cause serious problems. When you irritate nervous tissue enough times, this will slowly change its internal morphology, how it functions, how it works, and how it looks. Unfortunately, how it looks, for example, as seen on an MRI, is by far the last thing to change. When this day in and day out, week in and week out, month in and month out, and year in and year out scenario happens, you eventually run the risk of seeing something that would be termed chronic traumatic encephalopathy, or CTE. Unfortunately, this is primarily seen by medical professionals who take a look at the brain tissue under a microscope after death and go, aha, your brain has been basically changing in function, shape, and metabolism over time, and now we can see the change. From what I've learned, the change happens gradually over many years due to the mild compressive forces that happen inside the skull, with how I explained the fluid accumulation earlier. Unfortunately, in most cases, CTE isn't discovered until after a person has passed away prematurely, or worse yet, taken their own life because they could no longer stand for the changes they were living with on a daily basis, and doctors have had a chance to dissect the brain to determine what was going on inside the person's head.